Hello, my name is Marissa Fedele, and today I will be discussing the effects of exercise on pregnancy. Exercise is a vital part of daily living. It helps to promote weight loss and can even lower the risk of developing certain diseases, including obesity and type 2 diabetes. However, certain safety concerns have been raised in regard to exercising while pregnant. Adhering to nutrition and exercise recommendations during pregnancy may be challenging for some. Precautions should be taken before beginning an exercise regimen, and medical clearance should be given. One of the most obvious changes in pregnancy is the alteration of the woman's body. Some of these include mechanical, temperature, and hemodynamic changes. Mechanical changes can be observed from the weight of the growing breast, uterus, and fetus, as well as an increase in lumbar lordosis, resulting in a shift of the woman's center of gravity, causing balance issues. With this shift, weight-bearing exercises become a greater concern because of the increased impact of forces, elevating risk of injury. Pregnancy also causes an increase in joint laxity due to hormonal changes leading to a higher risk of strains or sprains. Another change the body goes through during pregnancy is the maternal and fetal temperature increase. The metabolic rate increases during both exercise and pregnancy, leading to more heat production. The fetal-placental metabolism will also generate heat on top of the maternal production. Many researchers believe that when you combine exercise and pregnancy, fetal heat dispersion to the mother will drop due to the rise in maternal core temperature. This heat effect in early stages of pregnancy have demonstrated a rise in congenital abnormalities, specifically midline fusion defects of the central nervous system. Exercise in pregnancy will automatically increase heart rate, stroke volume, and cardiac output. However, when a person partakes in an exercise activity, their blood is being diverted away from the abdominal viscera, which includes the uterus, so that it can supply the exercising muscles. Unlike blood supply, there is no significant change in fetal heart rate. Yet the two studies mentioned have detected fetal bradycardia during vigorous exercise in untrained women performing at or near maximal capacity that can usually be resolved within 2 minutes. However, when those same women exercised at 70% of their max aerobic power, it did not have the same effect. The last hemodynamic change that occurs is a greater cardiac output. This could be due to the increase in maternal plasma volume and heart rate, along with the decrease in vascular resistance, which helps to supply adequate amounts of blood flow to the placenta during pregnancy. In another study, an ST segment depression was discovered in about 12% of pregnant women that participated in strenuous bicycling. The changes in their ECG results weren't associated with any symptoms of cardiac ischemia and really had no harmful effects. In the end, the exact cause as to why this ST segment depression occurs is unknown, but it could be attributed to the altered sympathetic regulation. Along with mechanical, temperature, and hemodynamic changes on the body during pregnancy, adaptive variations in the pulmonary system and energy demands occur. During times of rest, pregnant and non-pregnant women have an equivalent respiratory frequency. However, slight increases in tidal volume and oxygen consumption are present in pregnant women and are most likely a result from the increased oxygen demands of the fetus. When pregnant women start to partake in mild exercise, they have a greater increase in respiratory frequency and oxygen consumption to meet the higher oxygen demands. Then, if they increase the intensity to moderate levels or above, they will exhibit a decreased respiratory frequency as well as a lower tidal volume and maximal oxygen consumption. The last change we will discuss is the heightened energy demands associated with pregnancy. Usually, doctors recommend that pregnant women expand their daily intake by 150 calories in the first 2 trimesters and even up to 300 in the third. Evidence has shown that if an individual chooses to exercise during pregnancy, they will probably want to increase their caloric intake by even more than what was previously stated in order to optimize fetal weight gain. Pregnancy affects all aspects of exercise by causing a progressive decline in performance, but has the biggest impact on weight-bearing exercises. Many women who engage in exercise throughout pregnancy will usually drop out by the time they reach the 3rd trimester due to fatigue, nausea, and other morphologic changes associated with pelvic pressure and discomfort. The performance levels of pregnant women will usually drop to 50% of their pre-pregnancy levels by the 6th month. However, interestingly enough, the decreased performance is not seen in non-weight-bearing exercises like swimming or biking. They are usually able to maintain high-intensity, moderate-duration exercise with no decline in overall performance. Exercise is known to increase levels of norepinephrine and epinephrine. Norepinephrine is shown to increase the strength and frequency of uterine contractions, while epinephrine is shown to inhibit the effect of uterine activity. Research has shown no significant differences in the maternal weight, infant birth weight, length of gestation, and length of labor from physical activity. However, the variability in the length of labor may be explained by the degree of conditioning in women. For well-conditioned women, they were found to have shorter labors with no premature onset or rupture of the membranes. Another interesting find is that women who exercised in the 3 months preceding pregnancy felt better during the first trimester than those that exercised in the first and second trimesters usually felt better in the third, with a decreased RPE during labor. Women who are in good health are generally permitted to engage in exercise while pregnant. However, those with complications should seek clearance and usually avoid vigorous activity. Some contraindications to exercise during pregnancy include pregnancy-induced hypertension, preterm rupture of membranes, preterm labor, persistent second or third trimester bleeding, and placenta previa, which can cause severe bleeding during pregnancy because it occurs when a baby's placenta partially or totally covers the mother's cervix. Although data is sparse, a conservative approach to exercise is necessary when doubt exists. Any exercise regimen should be individually structured to the patient, her goals, and her overall health. Although there are no clinical studies to date showing adverse effects of moderate exercise, you should still consult a doctor. It is recommended that the intensity, duration, and frequency of exercise should start at a level that does not result in pain, shortness of breath, or fatigue. Pregnant women will want to consistently check in with their progress and well-being, including hydration, caloric intake, quality of rest, and presence of muscle or joint pain. Hydration should be thoroughly emphasized throughout pregnancy. Pregnant women should drink 1 pint of liquid before exercising, and 1 cup of liquid every 20 minutes during exercise should be sufficient enough to maintain adequate hydration. Even if thirst is not prevalent, she should still try to get enough fluids. Maternal weight should also be monitored. The mother should show a normal weight gain throughout pregnancy, independent of exercise. Activities that require balance or extreme range of motion should be avoided late in pregnancy. Pregnant women should also avoid activities that involve a sudden change in body position due to the shift in their center of gravity, which causes increased instability. Activities that should be encouraged are walking, stationary cycling, low-impact aerobics, and swimming. Those which should be discouraged late in pregnancy are contact sports, horseback riding, skating, skiing, hang gliding, weightlifting, and scuba diving. Although there are many contraindications to exercising while pregnant, most can be avoided with proper guidance from a physician. Exercising for 30 minutes on most or all days can benefit your health during pregnancy. A new study has shown that newborns whose mothers exercise during pregnancy may become physically coordinated earlier than other babies whose mothers may have not participated in exercise. Another benefit mothers may experience is reduced back pain, constipation, and swelling. It may also prevent or treat gestational diabetes as well as an increase in mood and energy. In conclusion, if cleared by a physician, women who are pregnant will benefit from exercise. Before you begin an exercise program, make sure you have your healthcare providers okay. In case of heart and lung disease, cervical problems, and placental problems, a doctor may advise against exercise. In general, listen to your body and stop exercising if you feel dizzy, have chest pain, shortness of breath, tightenings in the stomach, or irregular heartbeats. Don't overdo it and avoid pushing yourself too hard as it can cause you to overheat, which is not good for the baby. Experts usually recommend low to moderate intensity, although you can maintain vigorous intensity with permission from your doctor. The hardest part to getting started is staying motivated, so start small, find a partner, or try a class. The test question I proposed is, which of the following is not an effect of pregnancy on the body? Is it A, increased joint laxity, B, decreased energy demands, C, increased metabolic rate, or D, greater cardiac output? If you guess B, then you're correct, because there is actually an increase in energy demands during pregnancy. Here are the references for my PowerPoint presentation. I want to thank you for listening, and I hope you were able to learn something new and exciting. Have a great rest of your day and school year.